Hi, this is Keith. This is the lecture for Chapter 2. This chapter focuses on studying sexuality. Let's begin. In this lecture, we will discuss sex, advice in the media and pop psychology, thinking objectively about sexuality, sex research methods, sex researchers and the history of sex research, as well as contemporary research studies that inform our understanding of sexuality. The amount of articles and stories we see every day about sex is really astounding. More than likely, we will encounter this information in what might be called the sex information advice genre. What this type of genre usually transmits is information about sex and norms about sexuality to the mass audience. In other words, it tells us who it's okay to have sex with, what kinds of sex is appropriate, and why we should have sex. The purpose of sex information and advice genre is to inform and entertain in a very simplified manner. In other words, generalizations abound. And like many of you may already know, this is a major source of information for college students. Think of the last time you saw an article about some aspect of sexuality and how that became part of a conversation with your friends later on. It's important to remember that the primary purpose of newspaper columns, internet sites, syndicated radio shows, magazine articles, and TV programs is financial profit. Now, this is in sharp contrast to scholarly research, which the motive is to seek knowledge. When we watch or read about sex, it's important to keep in mind that the success of media personalities rests on their ability to present information as entertainment. For these reasons, they often present the most bizarre or salacious story to keep the reader's or viewer's attention. Sex advice genre tends to focus on how to or morality. This transmits information to the audience that sex should be done in a certain way or with certain people and for the right reasons. And for all of these and other reasons, the line between media sex experts and advice columnists is often really blurred. This is partly because many people may not understand that line, and partly because a sex advice column may interview an expert but not tell the full nuanced story. And these lines are especially blurry on the internet where both credible and inaccurate information exists side by side. The use of statistics about sex and sexuality can be particularly tricky. For example, it's common for media to reinforce their authority by incorporating statistics from a study's finding, but often adding one statistic may not tell the complete story. And, as we all know, media may report the results of a study that might contradict prior or subsequent research. We often hear about contradictory results. For example, how harms of eating foods that are high in fat, whether that is good for you or bad for you, or the dangers or the benefits of alcohol consumption. The pendulum seems to be constantly swinging back and forth on these conclusions. And for these reasons, it's critical to replicate studies to see whether or not findings hold up. John Sacaluk noted that noted those concerns about the replicability of social science and medical research, and the concerns about replicability have really increased in recent years. In some ways, this has caused a bit of a crisis in social and behavioral sciences. Finally, media may oversimplify and distort information, leading to incorrect or only partially correct information. In the scientific study of human sexuality, we want to bring objectivity to the task. That is, we want to understand how things exist in reality as opposed to our feelings or beliefs about them. Objectivity in the study of sexuality is not always easy to achieve, since sexuality can be a focal point of powerful emotions and moral ambivalence. And it is because of this that we may experience sex in a very subjective way. In other words, one that is centered around our own experiences rather than understanding or appreciating the full spectrum of sexuality. One powerful method that we can use to think objectively about sexuality is the scientific method. As most of you already know, this method is one in which we propose a hypothesis, and then we test, and then that hypothesis is tested methodologically in order to draw conclusions about the phenomenon. One of the important dimensions of the scientific method is induction, which is when we draw a general conclusion from a series of specific facts. For example, the fact that we have observed the Earth from space, that we can travel around the world and end up back in the same place, and that there is a horizon all point to the conclusion that the Earth is round. We can use the same methodology to study behavioral and psychological phenomenon like human sexuality. And as we've discussed before, examining sex objectively can be difficult because sex has traditionally been viewed in moral terms. These moral terms lead us to make value judgments or evaluations based on moral or ethical standards rather than objective ones. However, moral judgments do not tell us anything about sexuality except how we ourselves feel about it. So, how do you tell the difference between a value judgment and an objective statement? Value judgments imply how a person ought to behave. They really can't be empirically validated. In contrast, objective statements describe how people actually behave, and they can be empirically validated. As an example, someone might believe that penetrative sex should only occur in missionary position. This is a value judgment. However, when we ask adults what sorts of sexual positioning they participate in with their partners, we find that people participate in a wide range of sexual positions during penetrative sex. This is an objective statement. So we'll talk in just a bit about how we can sort of evaluate things through measurement and testing. In addition to value judgments, we need some other definitions in our toolkit to understand not only what differentiates how sexuality is portrayed in the media, but to understand what can get in the way of rigorous research in human sexuality. First, we all have opinions or unsubstantiated beliefs or conclusions. These reflect our own personal values and biases. So if I say college students should wait until they are married to have sex, that is an opinion. In contrast, if I state most college students have sex with another person during their time in college, that can be confirmed by more objective research. But both opinion and research may be biased in some ways. Bias, Biases are personal leanings or inclinations that reflect a prejudice in favor or against a person, group, or thing in contrast to another. Scholars must work to avoid personal bias since bias can undermine the objectivity of the research. Other problems can arise from stereotypes. This is defined as a set of simplistic, rigidly held, overgeneralized beliefs. Stereotypes are often negative. For example, common sexual stereotypes include men are always ready for sex, nice quote unquote women are not interested in sex, women need a reason for sex, men need a place, virgins are uptight and asexual, relationships of gay men never last, and lesbian women hate men. So again, those are some common stereotypes. Stereotypes arise from our schemas, which are the ways in which we organize knowledge in our thought processes. While schemas can help us make sense of information we receive about the world around us, they can also be inaccurate or maladaptive. And that's often the case with stereotypes. Stereotypes lead us to see what we expect to see and ignore what we don't expect or don't want to see. So rather than seeing commonalities between humans, sexual stereotyping is often used to justify discrimination based on these perceived differences. So one thing we should ask ourselves is what leads to stereotyping and other forms of bias? One thing is what we call a fallacy, or an error in reasoning that affects our understanding of a subject. Two types of fallacies that are particularly important are the egocentric and ethnocentric fallacies. The egocentric fallacy is a mistaken belief that our own personal experience and values are generally held by others. For example, if you believe that sex should only occur after marriage, then the egocentric fallacy says that you think that other people also hold that same belief. Another type of fallacy is the ethnocentric fallacy, or ethnocentrism. This is the belief that our own group or culture is innately superior to others. For example, when we stereotype other cultures as primitive, innocent, inferior, or not as advanced. So, with this in mind, let's now turn to how we scientifically study sexuality. To achieve the highest level of objectivity, we rely on the scientific method, which was discussed in an earlier slide. Scientists who study sex are called sex researchers or sexologists. Sexologists use the same methodology as other social scientists, but are constrained by unique ethical concerns and sexual taboos. Scientific methods used by sexologists may include clinical research, survey research, observational research, and experimental research. So let's go ahead and take a look at each of these methods. But before we do, we want to take a closer look at some of the ethical issues inherent in human sexuality. A variety of ethical concerns arise when we enroll humans or subjects in our research studies. Critical questions we need to ask ourselves include how do we ethically study intimate sexual behavior? And what rights and responsibilities do participants have when they enroll into a study that deals with their sexual lives? For example, much of my research is around HIV prevention behaviors among persons in the LGBTQ plus community, which can get very personal. So how do we do this ethically? One way is through informed consent or a full disclosure to an individual of the purpose, potential risks, and benefits of participating in a research project. It's important to let participants know that they have the right to withdraw without penalty, are guaranteed anonymity and are entitled, or confidentiality, and are entitled to protection from harm. So the same ethical standards for all types of behavioral research with humans is also true in the field of sexology. As with most types of behavioral research, human sexuality is concerned with the accuracy of findings from studies. That can vary by the type of research. So in qualitative research, for example, words are the data that we're working with. In contrast, in quantitative research, numbers are the data. So in either case, concerns about accuracy lead us to closely examine how we sample participants from a general population. So imagine that you want to understand what percentage of adults in the US engage in sex before marriage. If we want an accurate answer to that question, we need to make sure that we use the best sampling methods that we can. The most unbiased type of sample is what we call a random sample. A random sample is one in which we select which the selection of each member is based solely on chance. So if we wanted to know what percentage of adults in the US have sex before marriage, we'd randomly select a certain percentage of adults among all of the adults living in the US now. However, doing that would be extremely difficult, and therefore we need other ways to sample people for our studies. A less perfect but more feasible way to do that is through a representative sample. A representative sample is a small group representing the larger group in terms of age, sex, ethnicity, socioeconomic status, sexual orientation, and so on. Continuing our example, rather than getting a random sample of all adults in the US, it's more feasible to get a smaller representative sample of US adults to tell us whether or not they have engaged in sex before marriage. However, representative samples can often be biased in some ways. Biased samples are those that are not representative of the larger group. Most samples in sex research are limited because they are biased in certain ways. For example, they often depend on volunteers or clients. These volunteers generally self-select into studies. No doubt people who volunteer for a sex study are probably pretty different than those who don't volunteer to be part of a sex study. Also, a lot of research uses students whose attitudes, values, and behaviors may be very different from those of other people in the US. Studies with primarily studies with primarily college students from Psychology 101 courses are biased because college students who take psychology courses are different than other peers for their age. To take this further, some ethnic groups are underrepresented because they may be underrepresented at colleges and universities. Finally, studies of LGBTQ plus individuals may be complicated by their understandable distrust of researchers in the process because of the fear for how these data will be used and how they will be portrayed in the research. Another concern in research is social desirability. This is the phenomenon where individuals may overrepresent desirable behaviors, for example, condom use. In addition, in some cases, that same participant may underreport stigmatized behaviors. So, a stigmatized behavior for some groups may be having multiple sex partners or extramarital sex. However, that same behavior may not be stigmatized in other groups. Social desirability has two components. The first is self-deception, where the person has an overly positive impression of themselves and their behaviors, and that they actually believe the responses that they are giving. In other words, their belief about themselves may not be entirely accurate. The second component is impression management. This is where the participant aims intentionally to misrepresent themselves in their responses to avoid social sanction or scrutiny. So this is a case where somebody is knowingly not being fully disclosing of themselves because of their concerns around negative repercussions. Now let's move into talking about different types of research that occurs in the study of human sexuality. The four types of research that we'll talk about are clinical research, survey research, observational research, and experimental research. Clinical research refers to an in-depth examination of an individual or group seeking assistance with psychological or medical problems or disorders. The use of a clinical research paradigm often arises when patients seek medical care for symptoms or a group of symptoms that are causing them discomfort or problems, but don't seem to fit a current diagnosis. So clinical research is undertaken to understand that set of symptoms. For this reason, clinical research is often descriptive, which means that we can't really talk about cause and effect from this type of research. And a major limitation is the emphasis on pathological behavior or unhealthy or diseased behavior. So clinical research plays an important role in understanding conditions, some of which may be sexual, that patients might seek medical care for. However, there are scientific methods that we can use to understand both pathological and healthy sexual behaviors and experiences. Now, one very common way to study human sexuality is through survey research. In survey research, we use questionnaires and or interviews to gather information about human sexual behavior and attitudes. Survey research is often used because it is fast and relatively inexpensive. However, survey research often does not provide in-depth responses, and therefore we may not understand in rich detail some aspects of human sexuality. Moreover, people often don't accurately report their own sexual behavior. So, for example, if I were to ask how many sexual partners and the frequency of sexual intercourse you've had in the past 12 months, it might be difficult for some to accurately respond to that. And this inaccuracy can bias the results of the study. One possible way that we can get more accurate data about sexual behavior is through the use of computer-assisted interviews and surveys. These are online surveys, and they're frequently used in human sexuality research. And studies show that participants are more likely to report sensitive behaviors in online surveys than they are in paper and pencil surveys, or through an interviewer-administered surveys. Another method for improving the accuracy of sexual behavior data is through the use of sexual diaries, which is the collection of information either daily or on a regular basis. Remembering and recording the kind of sex you had the day before is a lot easier than remembering how much sex you had in the previous year. In addition to clinical and survey research, we may also use observational methods. This is when a researcher observes and makes systematic notes about behaviors without trying to manipulate them. Clearly, there are some pretty serious ethical issues involved in observing sexual behavior without participants' knowledge and consent. However, there are also ethical issues in observing social and sexual behavior even when you have the consent of participants. An even more controversial method is called participant observation, where the researcher participates in the behavior that is being studied. So this would be a case when the researcher actually engages in sexual behavior and uses it as part of its data. So this brings up some pretty serious questions about objectivity as well as ethical responsibilities. Finally, the last research method we'll talk about today is experimental research. Experimental research is the systematic manipulation of individuals or the environment to learn the effects of such manipulation on behavior. Now, many of you have already taken research methods. So a typical example of experimental research is randomizing participants to one or more conditions, such as a new treatment for painful sexual intercourse, or randomizing them to the usual treatment for that symptom, and then seeing whether the new treatment is better than the old treatment. In experimental research, variables are those factors that can be manipulated. We manipulate what we call independent variables, for example, the new treatment for painful sexual intercourse, so that we can see whether or not the new treatment changes or impacts our dependent variable. And in this case, the dependent variable might be whether the participant reports lower levels of pain during sex. Now, it's important to note that we cannot manipulate or change all variables. And so, for example, there's no good way to manipulate age. We can't randomly assign age to one group of people and randomly assign a different age to another group of people. So we can't experimentally test the impact of age on some dependent variables. Rather, we can look at that association between age and some other variable in a correlational study. In correlational studies, we measure two or more naturally occurring variables to determine their relationship to each other. One way that we conduct experimental research in human sexuality is to measure physiological response. Plasmagraphs are devices attached to the genitals to measure physiological response. For example, one measure of physiological response is called strain gauge, which is measuring penis circumference and volume. In this way, physiological response can be measured to assess arousal while, for example, watching sexually explicit videos. Physiological response can also be measured among persons with a vagina by using a vaginal plasmograph to measure the amount of blood within the vaginal walls. However, caution should be used when interpreting the results of plasmographs, since blood flow and increasing circumference may not necessarily mean an increase in sexual desire or arousal. A couple of other types of research I want to mention are using big data and doing community-engaged participatory research. Big data refers to data that is generated through human activities and interactions with technology. I think most of us can agree that a huge part of our life is spent online and engaging with technology, whether it's through social media platforms like Instagram, TikTok, or whether it's accessing our medical records through an online portal. And anytime we interact with technology, our data are being stored somewhere, which can then be used to understand some phenomenon. For example, we can scour social media to understand people's beliefs and behaviors around seeking reproductive health services. Another example is the use of huge data sets from large health systems like Kaiser to understand some disease outcome, which then might lead to personalized medicine. Community-engaged participatory research has emerged as an important way to engage community members in the research process, from conceptualization of the project to interpretation of the data that come from that project. So in this type of approach, members of the community or insiders become part of the research team as they have intimate knowledge of the behavior we're trying to understand. This type of research can lead to more engagement from the community as well as a better understanding of their needs. A form of community involvement in research is through art-based methodologies. which emphasized participants as stakeholders and co-researchers in the research process. This tradition grew out of the social justice movement and uses techniques like digital storytelling, photo voice, and blogs to understand and study a particular phenomenon from the participants' perspectives. Okay, so let's turn next our attention to the pioneers in sex research. Sexuality research has a rich history, although earlier examinations into the origins and variations of sexual behavior were often guided by personal and cultural beliefs of that particular time. Sexuality was once the domain of religion, where treatises, canon law, sermons, and confessions cataloged the sins of the flesh. However, beginning in the 20th century, a more objective, modern view of sexuality emerged. Among these sort of sexual enthusiasts, quote unquote, three themes took root. First, the belief that sexual expression is essential to well being. Second, they sought to broaden the range of legitimate sexual activity. And third, they believed that female sexuality is the equal of male sexuality. So these might seem like pretty obvious attitudes to us today, but they were revolutionary for their time, as we'll see next. So Richard von Krafft-Ebing, who lived from 1840 to 1902, was probably the most influential of these early researchers. He was a Viennese professor of psychiatry, and in 1886 he published Psychopathia Sexualis. So this was a collection of histories of fetishes, sadists, masochists, and homosexuals. Krafft-Ebing traced variations in Victorian sexuality to hereditary taint, moral degeneracy, and in particular, masturbation. In his view, masturbation is really the root of all problems. While clearly misguided, he brought attention to and the discussion of sexual behaviors to the public realm. Thankfully, we've learned a lot more about human sexuality since this time. Next is someone that no doubt all of us can recognize, Sigmund Freud. Dr. Freud was instrumental in promoting the idea of the unconscious mind that drove much of human behavior, according to him. Much of his work centered around understanding and treating neuroses, which we more commonly refer to today as anxiety. He introduced the idea of repression, which keeps people from becoming aware of hidden memories and motives because they arouse guilt, and it prevents the knowledge of unconscious motives necessary for behavior change. The idea of a repressed memory gained a huge amount of traction in the 1980s around child sexual abuse cases. This idea and its journey into the mind led to the development of psychoanalysis, which described behavior to unconscious desires. So, for a variety of reasons, Freud's work is mostly considered historical, although certainly some ideas are still in use in popular culture today. Now, unlike many other scientists at the time, Freud believed that sexuality begins at birth. He proposed 5 stages of psychosexual development. So let's go through those stages. According to him, in the oral stage, infants have an autoerotic focus on the mouth from birth to age 1. Then from 1 to 3 years of age is the anal stage. Freud then believed the interest in genitals increased during the phallic stage from ages 3 to 5. This, according to him, is the critical period for both male and female development. So in this stage, we see the rise of the Oedipal and Electra complexes. So for the Oedipal complex, this is where he believed that boys developed a sexual desire for their mothers and a fear of their fathers. And this can lead to castration anxiety. The Electra complex is where girls develop a desire for their fathers and fears for their mother, and they develop penis envy. Obviously, these are ideas that we don't necessarily ascribe to today. But he believed that sexual impulses, when then in the second to last stage, he believed that sexual impulses went underground, and this was during the latency stage. And then the final stage in his model is that the interest in sexual intercourse emerged during the genital stage, and this occurred during puberty. Next is Havelock Ellis, who was the earliest important modern sexual theorist and scholar. He published a series of case studies, autobiographies, and personal letters in the studies of the psychology of sex. In this, he noted that the relativity of sexual values, describing different sexual practices and values in non-Western societies, and he also described here what was considered then indecent behavior in humans as occurring in the natural world of animals. At a time when masturbation was considered lewd and inappropriate, Havelock challenged this view and believed that it had positive effects of relieving tension. He also documented that women possess sexual desires and asserted that people were born homosexual and did not become homosexual through degeneracy. Now, a name that most of you may have heard of is Alfred Kinsey. Kinsey was instrumental in demonstrating that public beliefs and attitudes about sex and sexual behaviors did not match the private lives of most people. He sort of ripped the band-aid off of the illusion that the piousness around sex and sexuality that was publicly stated actually followed Americans to their bedrooms. Kinsey published The Sexual Behavior of the Human Male in 1948, followed by The Sexual Behavior of the Human Female in 1953. These are sometimes referred to as the Kinsey Reports. And what they documented was the extraordinary diversity of sexual behaviors. Kinsey was at the forefront of reevaluating the role that masturbation played in a person's sexual adjustment, given historically negative attitudes towards masturbation. He also demonstrated that many people had sexual experiences with persons of both sexes. Specifically, he found that half of men and 28% of women had same-sex sexual experiences, although fewer of them had these experiences that involved orgasms. And because of this rich diversity of practices, Kinsey ultimately rejected the dichotomy of sexual behaviors as either normal or abnormal. Instead, Kinsey wanted to sort of eliminate the concept, again, of this binary between heterosexual and homosexual identities, and instead he argued that there were only sexual behaviors on a continuum of sexual expression, as you can see here. So he developed the heterosexual homosexual rating scale in which individuals are rated based on other sex, in other words, sex between people of two different sexes, and or same-sex sexual behaviors and psychosexual reactions such as sex dreams and fantasies in the person's sexual history. So on the 7-point scale, one could range from exclusively heterosexual with no homosexual behavior, dreams, or fantasies, to equally heterosexual and homosexual to exclusively homosexual. Kinsey's work revolutionized our understanding of human sexuality, which was then followed by another famous pair of sexologists. So this famous pair of sexologists that you also might have heard of is William Masters and Virginia Johnson, also known as Masters and Johnson, and they're best known for their observational work on human sexual behavior. They observed and recorded the sexual response cycle of 382 men and 312 women in over 10,000 sexual episodes. Now, that's a lot of observation. In their book, Human Sexual Response, they found that male and female sexual responses are actually very similar. Through this work, they were the first to document that female orgasm primarily occurred through clitoral stimulation rather than penetration. Probably the biggest impact of their work is that it revealed new behavioral approaches to treat sexual problems using behavioral therapy rather than long-term psychoanalytic therapy. And we'll discuss many of these behavioral approaches later on in the course. Besides sex researchers who sort of pioneered the field that we've been talking about, there are a number of contemporary researchers whose name you might run across. Now, you can read a lot more about some of these people in the book, but this includes Anne Fasto Sterling, who is a leading expert in biology and gender development, Leonora Tiefer, who is a researcher, author, educator, feminist, psychologist, and activist who began her career studying hormones in hamsters. Julia Hyman has dedicated her career to understanding physiological, emotional, and cognitive aspects of sexuality and developing interventions to address sexual problems. Also, Michael Seto is a clinical and forensic psychologist who studies pedophilia, sexual offending, and online offending. A few others to note are Lisa Diamond's research on sexual fluidity, and this has really shaped our understanding of sexual orientation and how it may shift across the lifespan for people of all different genders. Monique Ward, who is a sexuality researcher who has studied child and adolescent sexual development with an emphasis on the role of parents, peers, and the media in sexual socialization. And finally, Aaron Dever. Aaron Dever is the founder and director of the world's largest transgender archives that documents more than 120 years of research and 60 years of activism that is dedicated to transgender activities, leaders, and researchers. So those are just some of the few people who are leading the field today. So while human sexuality has a long history, there is a recognition that a number of important groups and interests were not given adequate consideration historically. From this lack of research and attention, a number of important types of scholarship and research programs emerge. So let's take a look at a few of those. The first is feminism, which we define here as a movement towards equality for women and men and understanding the female experience in cultural and historical contexts. Feminism emerged in response to both cultural and historical asymmetry or unbalance between genders that has led to social categories like masculine, feminine, heterosexual, and homosexual. Feminism asserts that these identities are socially constructed. There are a number of basic principles to feminism, and that includes the observation that gender plays a significant role in all aspects of social life. Second, the female experience of sex has been devalued, as we saw in earlier notions of female sexuality. Third, that power is a critical element in male-female relationships. These power dynamics play out in both subtle and sometimes violent ways. And in the more subtle end is the prioritizing of male orgasm over female orgasm. And then on the violent end, of course, is sexual assault. And the fourth is that ethnic diversity must be addressed, especially at the intersection of ethnicity and female sexuality. A second perspective that arises from the tradition of feminism, queer, and critical scholarship is queer theory. Queer theory challenges what we call essentialist perspective on sex and gender. An essentialist perspective is one that asserts that there are inherent qualities of being a man or a woman, or being gay or straight. Instead, queer theory asserts that these concepts are socially constructed and bound by specific time and place in history. So one really cannot understand, according to this perspective, sexuality and all of its dimensions without understanding when it occurred and the context in which it occurred. Okay, so we'll end our lecture today on discussing a number of contemporary research studies. While there certainly is a long tradition of sex research, it's still an emerging field of study. So there are a number of large national studies that can help us understand sexuality in our current society. And one is the National Health and Social Life Survey, or NHSLS, which was conducted in 1994. The results of this large study in the US are still pretty consistent with our understanding of sexual behaviors today, although there are some exceptions to it. So this study found that Americans are generally sexually exclusive, have sex about once a week, and have what we would consider fairly traditional sexual behaviors. The study also found that orgasms appear to be very uncommon, or sorry, that orgasms appear to be very common for men, but uncommon for women, and that extramarital sex was the exception in partner sex. In addition, the study found that homosexuality was not as widely reported in the survey as was believed at the time. The study found that 9% of men and 4% of women engaged in same-sex sexual activity, and that 2.8% of men and 1.4% of women reported a homosexual identity. But keep in mind that this was conducted in 1994, and certainly reports of non-heterosexual identities have increased in recent years. Another large-scale survey started in 1973 and continues throughout today. And this is known as the National Survey of Family Growth. In this study, surveys were collected periodically to gain information about marriage, divorce, contraception, infertility, and the health of women and infants in the U.S. Some important findings are that most adults have had sexual intercourse, that men have report more sexual partners than women, and that only a small proportion of men or women self-identified in this survey as homosexual or bisexual. Now, today, our understanding of sexual behaviors and attitudes is informed by large studies that regularly document sexual practices and beliefs among adults and adolescents. One is the Youth Risk Behavior Survey, or YRBS, which is conducted every 2 years and measures the prevalence of 6 categories of health risk behaviors among youth. Many of the questions asked about sexuality were to understand the prevalence of behaviors that might lead to sexually transmitted infections or unintended pregnancies. In 2015, the YRBS report provided the first national estimate of the percentage of high school students who self-identified as gay, lesbian, or bisexual, as well as the percentage of high school students who have had any kind of sexual contact with same-sex partners or both sex partners. The National College Health Assessment is conducted every spring and fall to assess college students' health behaviors and their perceptions of the prevalence of these behaviors among their peers. It assesses everything from violence to alcohol and drug use, nutrition, mental health, and of course, sexual behavior. From the National College Health Assessment in 2023, you can see here the percentage of undergraduate college students who reported anal, vaginal, and oral intercourse in the past 30 days by gender status. So either transgender or gender nonconforming, cisgender women or cisgender men. As you can see here, cisgender women had the highest percentage of engaging in oral sex in the past 30 days, although only slightly higher than the other groups. In the middle column is shown that cisgender women and cisgender men have the greatest percentage of those who engage in vaginal sex in the past 30 days, while anal sex was most often reported by transgender persons or cisgender men. This kind of information can be then used to target interventions and programs to improve the sexual health of different groups. Finally, the National Survey of Sexual Health and Behavior, or NSSHB, is the most expansive nationally representative study of sexual and sexual health behaviors among U.S. adolescents and adults ages 14 to 94. The NSSHB report was published way back in 2010. The survey revealed an increase in sexual diversity since the National Health and Social Life Survey was reported back in 1994. So the NSSHB, the survey we're talking about here, updated our understanding of American sexual behavior by presenting data on masturbation, oral sex, vaginal intercourse, and anal intercourse across categorized by 10 age ranges. Results, for example, revealed that masturbation, oral sex, and vaginal intercourse were prevalent among all racial and ethnic groups and among men and women throughout the life course. And this concludes the lecture for Chapter 2.